Have you come across the term ASCUS in cervical pap smears before?
Yes, it stands for atypical squamous cells of undetermined significance, a diagnosis when cell changes are unclear but not definitively abnormal.
I read that ASCUS includes mild nuclear enlargement and irregular nuclear contours but lacks the full features of precancerous lesions.
That's right. The Bethesda system introduced this term to address cases where changes can't be clearly classified as benign or dysplastic.
Is ASCUS linked to HPV infections or other causes?
Yes, it can be associated with benign reactive processes, infections, or early HPV-related changes, but also carries a small risk of cervical intraepithelial neoplasia.
What does management usually involve after an ASCUS result?
Typically, reflex high-risk HPV testing is performed. If positive, colposcopic evaluation is recommended, based on 2019 ASCCP guidelines.
And if the HPV test is negative, what happens then?
The risk of progression to high-grade lesions is extremely low, less than 1% over 5 years, so routine screening intervals are usually resumed.
That's reassuring. I also heard that the negative predictive value of high-risk HPV testing in ASCUS cases exceeds 99%.
Exactly, which provides strong reassurance that significant precancerous lesions are unlikely in the short to medium term.
Are there special considerations for certain patient groups with ASCUS?
Yes, immunosuppressed patients and those with a history of high-grade lesions are referred directly for colposcopy, reflecting tailored management.
Thanks for breaking that down. It really highlights how nuanced cervical screening can be.
Absolutely, understanding ASCUS helps ensure appropriate follow-up and monitoring based on individual risk.